Care facilities are some of the most common places for rapid COVID transmission. But in Missouri, the health inspectors who check those facilities are not getting vaccinated before they go in. KMBC 9's Michael Mahoney is breaking this story. He has more on what's being done about it.
Those state health department inspectors and the ombudsman, the advocate who check on nursing home complaints, were not included in the first vaccination wave covering those centers and their healthcare workers.
Health inspectors and ombudsmen, they should have already had the shot.
Craig Eichelman of the Missouri chapter of the AARP. The state's Department of Health and Senior Services say their inspectors and those advocates are now in Phase 1B, Tier 1, along with many first responders. The AARP's Eichelman calls those state workers vulnerable Missourians.
These people go into multiple nursing homes. And as a reminder, 40% of the COVID deaths in Missouri are residents or workers in nursing homes.
KMBC News has also obtained a set of emails about the health department's next steps. Today, the health department workers got one stating the department is making plans for regional vaccination events around the state, and workers are being asked to complete a survey on whether or not they want to get vaccinated. It's not known if any state workers got sick, but they were not covered in the first wave of vaccinations intended for the residents of long-term care facilities and the workers who work there. Michael Mahoney, KMBC 9 News.
Missouri has more than 1,100 long-term care facilities. Residents and workers started getting vaccinated in late December. Today, hundreds of people lined up in Johnson County, Kansas to get vaccinated. This is part of Phase 2 for the state's vaccine plan. Some people who went to the Mid-America West Sports Complex in Shawnee say there's room for improvement in the process. This phase is for people 80 and older. It also applies to people in education, food, agriculture, childcare, and emergency responders.
I'm not as scared about the side effects of the vaccine for me. I'm more scared of if I'm a silent carrier and it going to a family member or someone that's going to be really affected from the virus itself. So
this means relief?
Yeah.
Johnson County has the most vaccinations in Kansas, with more than 6,000 people getting shots. Today, people got COVID-19 vaccines at a church on Kansas City's east side. KMBC 9's Matt Fleener explains.
It's one of our area's first COVID-19 mobile vaccination centers, sponsored by Truman Medical Centers and hosted here by Morning Star Missionary Baptist Church.
I'm not even going to watch.
Pastor Darren Edwards was one of the first to receive the vaccine on Tuesday.
That's it.
Truman Medical Centers partnering with churches to bring COVID-19 vaccines directly to zip codes in Kansas City with a high number of cases and deaths.
We know the people that live in the zip codes that have been disproportionately affected by this disease, and we came out to reach them.
I barely felt it.
Pastor Edwards says it's important to show his congregation and all of Kansas City the COVID vaccine will save lives.
I want to show my trust to the greater Kansas City community to let them know you can trust me for those who follow me and like me all throughout the area.
Truman Medical Centers is planning more vaccination clinics as doses become available.
How you feeling? This has been great.
Matt Fleener, KMBC 9 News.
KMBC 9 News has shown how COVID has disproportionately impacted zip codes where people got those vaccines today. You can watch Chronicle Systemic Pandemic right now at KMBC.com. And we have more updates on the vaccine front. Johnson & Johnson expects to share details on its Phase 3 vaccine study next week. Early results show a single dose could induce a strong immune response in nearly all the people who got the vaccine. If the Johnson & Johnson vaccine is effective, it could speed up the U.S. vaccine rollout, and that's because it is one dose, while the authorized vaccines from Pfizer and Moderna require 2 doses. Pfizer says it's delivered 200 million doses in the U.S. 2 months earlier than planned. That's because pharmacists have been able to extract 6 doses from each vial. Each vial had been designed to contain just 5 doses. Pfizer and the federal government will be keeping track of the vaccine sites that have been able to extract the full 6 doses. Regeneron says its antibody cocktail can prevent COVID-19 in people who've been exposed to the virus. That's based on data from a late-stage study. The drug maker says the cocktail caused a 100% reduction in symptomatic infections. The trial consisted of 400 people who had a household member with COVID. Supply continues to be an issue. Kansas gets 45,000 vaccine doses per week. That's 1% of the nationwide supply because Kansas makes up about 1% of the country's population. State Health Secretary Dr. Lee Norman says the state then spreads that out to 105 counties.
One of the things that's driven the vaccinating sites a little crazy is one, not knowing when it's going to arrive, and the second, not knowing the number of doses. Because you can imagine it's hard to run a vaccination clinic if you don't know if you're going to have 100 doses or 1,000 doses. But we're trying to be predictable.
The nation is struggling with vaccine shortages, but President Biden is announcing some new measures to shore up the supply and contain the virus. KMBC 9's Sally Kidd has the story now from Washington.
Governors have been sounding the alarm, so the White House is calling this a reset, an effort to bolster vaccine supplies and transparency.
Across the country, vaccine shortages and long lines, and a growing number of vaccination sites canceling appointments. The Biden administration now saying it will buy an additional 100 million doses each of the Pfizer and Moderna vaccines.
All of those components will lead to expediting. We're not asking states to do this on their own. In fact, we are trying to reset and be partners here in a more effective way than we've seen over the last 10 months.
The White House says states will see a 20% increase in vaccine distribution from 8.6 million doses nationwide per week to 10 million starting next week. And they'll be getting 3 weeks advance notice of how much they can expect to receive. Meantime, on Capitol Hill, Democrats are pushing forward with a nearly $2 trillion COVID relief package and getting some resistance from Republicans.
I think it makes sense for us as we go through this to take a really hard look at how we're spending every one of those dollars and ensuring that it is targeted, it is fiscally responsible.
The work must move forward, preferably with our Republican colleagues, but without them if we must.
As deaths top 423,000 and counting.
And one more point here, this boost in vaccine supply to the states only occurs over the next 3 weeks. So it's not clear what happens after that. In Washington, I'm Sally Kidd.
KMBC 9 News is compiling answers to viewer questions about the vaccine on our website. We're also posting state and county specific information on vaccines from local health officials. That includes who will qualify for a vaccine and how and when to sign up. You can find all that information at kmbc.com/vaccine.